Hi, good afternoon, and welcome to the Fertility Hub seminar on crisis management, marketing, and communications. I'm just going to share my screen with you now so that we can start the presentation. So I'm Veronica Montgomery, and I am the Clinic and Patient Liaison Consultant here at the Fertility Hub. My job is to answer all of the patient inquiries and refer them on to the healthcare providers that we've partnered with who advertise their clinic services under our places for treatment on the Fertility Hub. And I handle all commercial aspects and partnerships in the assisted reproduction industry to connect healthcare providers with suppliers and generally all other commercial aspects of running the Fertility Hub. So in this presentation, I'm going to give you a brief background on myself and why I'm giving you this presentation today. Throughout this crisis, COVID-19, I have been writing a weekly series of blogs every Wednesday, looking at all elements of crisis management, marketing and communications in bite-sized pieces and breaking that down to all the different tools in the marketing toolbox. Also, today there's been nine blogs so far, and today I'm just going to look at 4 of those and just do a synopsis of them. So that is crisis management, elements of the marketing communications, the financial implications of COVID-19 for us as an industry, and the use of PR. There will be another seminar on the 30th of June, and registration for that will open next week, where we can look at another 4 elements of the blog series. So my background is that I've had 30 years experience working in media and marketing, and for the last 16 I've specifically worked within the marketing to IVF patients and in the assisted reproduction industry. So I started my career at the Royal College of Nursing, where I was advertising manager, and I worked across 8 nursing titles in all different disciplines of nursing. Then I jumped across the fence from being the media to a media buyer when I became a director at Kingsway Advertising, and there we specialised in health marketing for NHS trusts here in the UK. Then I did a really big leap, and I went all the way across the Atlantic to the Caribbean island of Barbados and set up a media and marketing consultancy there. And my main client was the Barbados Fertility Centre. So you may have come across me before. I've spoken at many conferences on medical tourism. I've spoken about marketing, and I've also had a chapter published in the Spicer scientific publication, Managing an IVF Unit, where I supplied the full chapter on how to market an IVF unit. I finished in Barbados in 2018, and that is when I founded the Fertility Hub. The Fertility Hub is a publishing platform that brings both patients and healthcare providers in assisted reproduction together under one umbrella. My idea with the Fertility Hub was that there, being a media buyer for 15 years, trying to reach IVF patients, there was a lot of places that we could reach patients, but essentially a lot of sites were mainly sort of a catalogue of places people could go. I felt that the news wasn't updated very often, and I was very keen that we did daily updates on the Fertility Hub, and that also for us working in the industry, there was nowhere for me to go. The main publications were very scientific and really geared towards the embryologists and the fertility specialists, the clinicians. So somebody working in operations or the nursing staff, or for me in marketing, there was no place I could go that brought everything together about assisted reproduction. And that is essentially what the Fertility Hub's goal is to bring all elements of assisted reproduction together under one roof. So in terms of the main site, which is where you will will have gone to register for this seminar today. That's the fertilityhub.com, and on there we see about 15,000 patients a month. Then there's a gateway from that main site which says healthcare professionals. Click here, and that takes you through to the locked access area. So that's like a back room where healthcare professionals can talk amongst themselves. In there you'll find supplier update, research update, clinical updates, and news specific to healthcare providers only. There's also an assisted reproduction job section, and you can also register if you're looking for a job so that we can match you with vacancies as and when they come up. And that launched back in March 2019. So all of a sudden, we now find ourselves in March 2020. I'm well aware it's May now. So that's sort of when this crisis really began to take a hold on us all. So COVID-19 is the biggest health and economic emergency that any of us will have ever faced. And we knew from the outset that this could and would have implications for us in assisted reproduction. I think I first discovered it between the Christmas and New Year break when I first read about COVID-19 and thought, oh, that's very worrying. From when we came back to work in January after the Christmas break, in discussions with editorial, it was, we need to keep an eye on this. I personally was very concerned this was going to be another Zika virus, and what were the implications for pregnant women and how would this affect the IVF market. So we've kept up to date on guidelines from the Royal College of Obstetricians and Gynecologists and the American Society of Obstetricians and Gynecologists as well. And thankfully, touch wood, so far we're not seeing any adverse effects in becoming pregnant or through carrying pregnancy, carrying a baby to term in pregnancy with a contraction of COVID-19. But we started to see in February the air travel being restricted. And for a lot of clinics, there are various places in the world where they've set themselves up as fertility tourist hubs. And for those clinics, they started to worry because the air travel was restricted, and overnight their global market became a local one. Within days of that happening, ASRM then issued guidelines to suspend treatment. Within another few days, that was closely followed by ESHRE and then eventually the HFEA. So pretty much the US, the UK and Europe were now closed to patients. Instantly, this meant huge operational changes as clinics now had to, if they weren't already adopting telehealth, they had to quickly move over to patient consultations by video where they could. And also the devastating task of having to decide which patients you could finish their treatment, which patients you were going to have to opt for freezing eggs or freezing embryos. Understandably, the patients were absolutely devastated to receive this news. One of the questions I had prior to this seminar from somebody who'd registered was asking the management for more support during this time. Obviously, it was really difficult having to tell the patients, A, that their treatment wasn't going ahead, and B, you can't tell them when it was going to start again. So the nursing staff and the international patient liaison all had to take quite a bit of flack from the patients, but of course the industry, our hands were completely tied. So yes, there's a request for support, no staff, and now clinics are starting to reopen, and now the big sort of elbow shoving's going on of patients trying to be first in line to get their treatment. And again, that's the clinical decision made by each individual unit as to who's coming up to their cut-off time and needs to be ahead of the queue. And also, just based on maternal age, really. So it's been a very devastating time, both for you as healthcare professionals and for your staff and obviously the patients as well. It's been a really weird time because we've had a huge upsurge in patient inquiries. As all the clinics closed down, the inquiries went absolutely crazy at our end because patients were desperately looking at to find out which clinics were open and where they could go. But obviously with limited air travel and countries going into lockdown as the COVID-19 started to spread, there really wasn't anywhere to refer them to. The knee-jerk reaction of the clinics was not only to, obviously they had to shut up shop, but also to freeze the marketing budget and to suspend all marketing activity. Now, throughout my blog series, I've really encouraged clinics not to do this because the patients had time on their hands. You know, most of them have been in lockdown of some description. Therefore, they were able to really put some thought to this of where they were going to have treatment and really dream and plan that future with a family. So by not having any marketing out there, patients have felt very abandoned by clinics. And I'll come on to that in our patient survey a little bit later on. So whilst this particular COVID-19, this pandemic was new to all of us, something that's not new to me, and I'm sure many of you who've been working for as long as I have, the recession is not new, and nor is a health crisis. I've worked through a number of both in my time, and you know, we have to keep going. And you know, again, we've got more operational changes because now clinics have been allowed to reopen, depending on where you are and what your guidelines are. I know for the HFEA, you have to apply to reopen and fill out their self-assessment form on how you are COVID secure and get approval from your HFEA inspector before you can reopen again. So there's lots of new procedures that have to be in place, such as social distancing, so you can have less patients in the clinic at any one time, PPE for the staff, and also, you know, checking patients for COVID as well. So lots and lots of operational changes, and as a business model as a whole, it's all under review, and you know, we're all sort of learning on the job at the moment. One thing recession has shown us is that companies who thrive in a recession are those who are very bold and actually increase their marketing budget. Now, I'm sure for anybody from finance who's watching this, I probably just caused a few palpitations. I'm afraid I've got a few more coming up for you, but I will share with you some ideas on A, how to create revenue, and B, how we can still continue communications and marketing, but we don't have to break the bank. Okay, so it's you know, a good analogy and a good saying is that when the clinic is busy, you should advertise. When there's an economic downturn, you must advertise. So depending on the size of your clinic, you may or may not have a dedicated marketing team. Some of the smaller clinics don't, and that may fall under operations, practice manager. Sometimes it even comes down to the nursing patient liaison staff. I would really recommend to survive this crisis, you do need a dedicated marketing specialist. So now is the time to get one if you don't have one already. Throughout this time, you need to keep your patients engaged, and hopefully you've been doing that whilst the clinic has been closed. Hopefully you've been maintaining regular patient contact, and if you're still in a position that you haven't opened yet or that you are waiting on overseas patients to return, do keep you know, in contact with those patients. Have the nurses call them on a regular basis, just a quick chat, check in, see how they're doing, keep on their radar. Do keep up your social media presence. There's a lot of negativity out there. Try and put out some really positive and hopeful messages. Share useful reading material. People have got time now to really understand their diagnosis and look into all different treatment options. Shout about those positive pregnancy tests, because you will have had some during the time the clinic was closed. So if you didn't announce them then, announce them now. Also, you've got new arrivals, you know, you were successful 9 months ago. That's all the sort of positive news that patients need to keep that dream alive and their hope alive. Try and avoid COVID-19 emails. That definitely is the subject matter. I totally appreciate that you do have to talk to them about the operational changes, and only send a COVID-19 email if it is relevant to that patient on how you're going to protect them when they come in the clinic, what your new operational procedures are going to be, if your opening hours have changed, all of those things connected to COVID. But essentially, I've had a million emails from every company that I've ever signed up to their newsletter or used their website, asking how I'm doing, how I'm coping. I never knew my DIY store cared so much, nor the local takeaway. It's insensitive marketing. You know, this disease has been very, very serious. It is very serious. You know, we are still seeing a couple of hundred deaths a day here in the UK. We're still seeing a couple of thousand new infections. And that's, you know, still the same pretty much around the world. Some places have got on top of it, but of course we're still locked down on air travel. So, you know, we're not out of the woods yet, and it is insensitive marketing from these companies because you don't know who's lost a loved one and you don't know who's currently infected and suffering with it. So yes, just avoid COVID-19 emails if you can. If it is relevant, then obviously do send them. These are things patients need to know. Keep recruiting new subscribers to your newsletter. Newsletters often get overlooked, and they're one of the most powerful tools in your marketing toolbox. So definitely use those. It does remind patients of you. It may have been a couple of years since they last spoke to you. It might have been a couple of months, but just keep your name in front of them. Now is a great time to let your patients get to know you. We've got very used to seeing politicians in their dressing gown talking over their boiled egg and soldiers. We've got very used to seeing big mega artists, you know, playing guitar on their bed. So really, you know, the whole polished image and corporate identity and branding, nobody cares anymore. You know, at this precise moment, people just want information. You know, people are used to the dog barking in the background, the kids climbing all over you. You know, just do videos from home, let people into your personal space. Because we're socially distant and we've all been isolated, people really need that connection, and patients are more likely to stick with a clinic where they feel they have that personal connection. So really try and establish that. And again, it's where I make the finance people feel uncomfortable. Whoever is in charge of your marketing budget, whether that be operations, the clinic director, or your dedicated marketing department, I want you to challenge finance and fight for that marketing budget. It really has never been so important. I totally understand there must be cuts. There has been no income for the last couple of months during shutdown, and IVF is an expensive business. The overheads are expensive, and you know, there's a huge gaping hole in the budget, and you know that has to be made up for in a cutback on spending. But I would argue that you have to keep marketing. So keep drip feeding content. We're very much on information overload. We're trying to keep up with our government guidelines, how the law has changed, what our local guidelines are. We've got so much information to take in at the moment. And whilst your message is important and patients do want to hear from you, just keep it short and sweet, because there's a lot of fear. There's a lot of anxiety generally amongst infertility patients because they don't know if they're ever going to get pregnant. And now with restrictions, they've just been like, when am I ever going to get treatment? So then add to that the isolation, there's depression, there's fear, there's anxiety. So keep it short, sharp, and also appreciate it's not business as usual. We are nowhere near business as usual. You might be really busy because you've been allowed to open and you're trying to cram all the patients back into a schedule that's now been reduced because you can only see so many patients and keep them all socially distant. But it is, we want to move forward. We want to get through this crisis. But a lot of people, everybody's at a different stage, and you just need to appreciate that with your marketing. Do highlight any help you have on offer. If you offer a wellbeing program, do you have any mental health counsellors? Do you have guidance for mental health and how to improve mental health? And again, just counselling in general. So highlight any of those services that are on offer. Okay, now moving on to the financial implications. This is very scary viewing, but as I've said, if we do this right, we will come through the other side, but we have got a very challenging time ahead. Normally, economists would look to the assisted reproduction market for the indication of a country's economy. If cycle numbers are up, that equals a healthy economy because couples can afford treatment and, more importantly, they can afford to raise a child for the next 18 to 21 years. Now, the current situation means that there's been no cycles happening, so economists can't look to the assisted reproduction to give us an idea of the economy. But what we can do is look how quickly unemployment rose in the first 2 weeks of clinics suspending treatment. So my first graph here looks at USA unemployment, and by the 21st of March, which was probably about a week after ASAM suspended treatments, by then 3.3 million had already registered as unemployed. A week later, that had risen to 9.95 million. Throughout April, unfortunately, there were 6.6 million people per week registering for unemployment in the United States, and that figure currently stands at 39 million, and we're nowhere near done, unfortunately, and there are still pockets of hotspots in the United States. So that's very concerning. The picture in the UK is less stark. By the end of March, unemployment was up to 950,000, which was a huge jump. That's now doubled. It's at 2 million, but we're not really getting the true picture, because what the government did here in the UK was they put people on the furlough scheme, which is the employers, rather than make their staff redundant because they've had to suspend trading, what they did was they could furlough their staff, and the government would pay 80% of their salary. Now that scheme was due to go until the end of June, and the government have announced now they're going to hold that over to the end of October, but with employer contributions from July. So again, that all depends on which companies can reopen by July and start trading again, and which companies just unfortunately won't have any money in the bank to pay their staff in July. So we do expect to see those 8 million on furlough sadly head to the unemployment queue as well. So what can we do? We know that we have got this global economic crisis upon us, and we're asking patients to pay for treatment. And, how is the industry supposed to get back on its feet? So I've looked back to a Greek study that was published actually the latter part of last year. And that looked at the financial crash of 2009, which obviously Greece was very badly affected. And that looked at the assisted reproduction figures prior to that 2009, excuse me, 2009 financial crash. Then it looked at the figures during the financial crisis, and then it looked at the figures during the financial crisis after IVF clinics reduced their prices. That study concluded that the uptake of assisted reproduction soared once there was an entry level. So it really was the price point that was stopping patients from accessing treatment. The full study can be found on the blog, which is under Managing an IVF Unit, and this one is called The Financial Implications of COVID-19. I'll do a link to all the blogs at the very end. Another really interesting study is that the ASRM did, that came out in 2015, and that looked also at the financial crash, the Great Recession of 2009, 2008, 2009. And that looked at IVF services between 2000 to 2011. And it looked at the relationship between the economic downturn and state mandatory health insurance. Now, there's what they established with that was that there was a very strong relationship between the uptake of art services where there was state mandatory health insurance. Where there wasn't the mandatory health insurance, the average price of IVF back in 2009 was £15,000, 15,000 US dollars. And really scarily, clinics had to slash their prices down to 2,000 US dollars in order to attract patients. So with this, I mean, what I'm trying to put across is forewarned is forearmed, and we do need to be prepared to adjust our business model and adjust our marketing methods to reach those patients who will be able to access treatment. So there is good news, I'm pleased to say, and that is, again, looking back over history, we see that healthcare is one of the most stable markets in a recession. There are there's fewer job losses in the healthcare market, and hopefully the same can be said for IVF units. You need to look at how your patients have been funding their treatment. So look at last year's cycles and where you were targeting patients and how they were funding it, and adapt your marketing accordingly. So here I would just want to play devil's advocate, because our perception of potential problems is this big. There's a huge gap in our knowledge, especially with COVID-19. You know, there's so much we still don't know and we're still finding out. So in reality, we thought our problems were this big. They're probably going to be that big. So I've just done a few examples of how patients might pay for treatment and how that might be affected by the current crisis. So if they've already paid for treatment and this was suspended and now they're booked back in, there's no change there because they've already paid and you've got the money and the treatment's going to go ahead. So that's all fine. If the patient wanted to pay with savings, they may be inclined to hang on to those now because they might need those savings to live on if they've lost income. They may have secured a loan for their treatment, which again may not go ahead if their employment status has changed. They may have opted to pay for it with a credit card, which now they're using for everyday living expenses. Health insurance that covers fertility treatment. This depends on whether it's a personal policy or whether that's an employer policy. Again, this may be affected if their job is no longer secure. And if it's an employee benefit that covers fertility, again, that all depends on their job security. So all of these things you need to look into and look at all the different scenarios and really spend some time on your marketing strategy and your plan of how you're going to adapt to what is our new normal for the foreseeable future. As part of this, I really want to reiterate the importance of teamwork. And that is that your finance and your marketing department really must work hand in hand now. You know, as marketing professionals, you need to understand that there was no income for 2 months and therefore marketing budgets will be reduced. But finance need to understand that if you don't continue to market, you'll have no new patient inquiries and you'll have no revenue a few months down the line. So the two have really got to work, you know, like this now, very close, and find a way through this that, you know, and marketing professionals have got to be very clever and smart in how you're spending the company money. Don't just reduce your prices because your competitors are. Do that market research, know your client base, and you will then know whether or not, if 80% of your patients are using health insurance, you've no need to reduce your prices. If 80% of your patients are self-funding and you know that we've got a global recession going on, then you're going to need to adjust your pricing policy. It's also really important that you discuss this vulnerability with the whole team. You never know who in that team is going to come up with the light bulb moment. They're going to come up with an initiative that could just see your clinic surviving this recession. Involve your whole team in these decisions, because transparency gains the team's trust. And at some stage, you may need to ask them, can they work overtime for no extra pay? Would they mind taking a pay cut while we get through this difficult period? Your team are far more likely to support you and be willing to support these initiatives if they've been involved in the decision process along the way. And units who continue to market will weather this storm. And in practicing what I preach, I did actually do a patient survey about 4 weeks ago, which resulted in us launching the Fertility Hub payment plan. So what we're encouraging patients to do is to dream of that family, plan that family, and then go on and do it. So our patient survey showed us that 75% of patients are currently worried about how they're going to pay for treatment. They were interested in payment plans. 68% of them sadly felt they weren't supported by their IVF provider. Now, whether that's because their clinic closed and didn't keep up any marketing and didn't keep up contact with them, but again, that's something to be aware of, that patients feel a little bit neglected during this time. Hopefully now, you can reopen and they're going to be able to have their treatment. The payment plan really works well if you are in a position that your patients are coming from overseas, because they can schedule treatment for 12 months, 18 months, or 24 months. It gives you monthly revenue coming in, and it gives the patient affordable monthly payments that they know they can meet, especially if if one partner has lost their income and is currently looking for new employment. So we've had quite a few clinics take us up on that. And what we're doing then is, when patients specifically inquire about the payment plan, we refer them on to those clinics who've joined up on the scheme. Then I want to talk to you about public relations, and this is the last segment of today's seminar. And again, I just want to reiterate that marketing is not a cost now. Marketing is an investment in the future of your IVF unit. Now, public relations is a communication strategy. It's communicating through a trusted source, and it's great because it's free. Advertising is what you pay for, publicity is what you pray for. And cost cutting is the name of the game. This should help your finance department on those budgets. And again, if you haven't got a marketing specialist on your team, and somebody who can do your PR, you really need to invest in one now. Patients are more inclined to believe what they hear on the radio, what they read in a newspaper or magazine, or what they see on the TV, as it's coming from a third-party medium. So PR really is worth its weight in gold. The great thing about having a good PR person is they put a positive spin on a crisis. And boy, is this a crisis. And what we really need is positivity right now. So a good PR will either piggyback the current news and add to it how this has impacted on you and what your operational changes are, or they'll create a whole new story. There's some wonderful stories that have come out of COVID-19, and we all like to hear them some stage during the day going, oh, that's a nice story. So think about your story. What is it a patient wants to hear? And then your PR person needs to pitch this to a journalist. And you have to ask yourself, it's no good saying, we got all new equipment, go and make sure everybody knows about that. The piece has got to be of public interest. It's got to be a humanity story. And you need to look at PR is a mirror, and it reflects how you want to portray your clinic. PR is also all about networking, and your marketing department, your PR person will not only have a list of all the journalists who they've built a relationship with, but also I always keep a list of influencers. So people who I want to know my news, who are going to share it, people who are quite big in the industry, people who put out really good newsletters, that sort of thing, people who've got a big social media presence. So a whole list of influencers that need to know your news. Your PR person also writes the pitch to the journalist and knows what to include in that pitch. The PR also writes speeches and presentations for your clinic directors. They will also get quotes from your government and also from the governing bodies within assisted reproduction, because this adds weight to the credibility of your story. Okay, knowing how to pitch to the journalist as well. You want a short introduction to your clinic. Then you want to outline the story that you are pitching. You want to highlight the issues that this story addresses, highlight what the public interest element and angle of the story is, and close your email to them with why this particular story needs this journalist's attention, and schedule at the end of that of, I can be contacted on this number to discuss this further. Appreciate you're quite busy at the moment. If I haven't heard from you, I'll follow up on Friday. So you've told them that you're available if they want to discuss it sooner, but if not, you're going to be back in touch with them. Okay, so moving on, this is coming to the end of the presentation now. Just to reiterate other elements of what a PR is responsible for. So your public relations person will write your press releases. They will blog on your behalf, and blogging is really good in IVF because blogging is personal. It's a personal opinion piece. Nobody's towing the company line here. This is an opinion piece. It's a blog. And so therefore, you know, we can talk about our own personal experiences, our opinion on things. And that's what patients really resonate with, because, you know, infertility is a very personal journey. And if you have regular bloggers, whether they, you know, get your doctors to blog, get members of your staff to blog, they always make good analogies of things that are going on in their life and how they can relate to patients over it. Also, your PR will conduct your market research and give you that data to plan do your marketing plan and your marketing budget, because they'll have done that market research and told you what the patients are thinking. PR would also subscribe to different news services and, you know, be the first there when a journalist needs an expert opinion to give an opinion on that. They will comment on stories that are relevant in the industry and start the conversation, and also be renowned amongst their group of journalists that if you need something on women's health or you need something on assisted reproduction, we're very approachable, and we'll always make a doctor available for an interview for you. Okay, all blogs are available here, which is at thefertilityhub.com/managing an IVF unit. And as I say, there will be another seminar on the 30th of June, same time, 5 p.m. And again, if you couldn't join us live for this one, we will send a link so that you can watch it afterwards, as I have recorded it. Lastly, I'm very excited because for the last 6 weeks, I have been looking into antibody testing and wondering how this might help clinics get through the problem of if a patient has had COVID, if a patient hasn't had COVID. I appreciate there are still huge gaps in knowledge as to how long, if you are immune, well, if you have antibodies to COVID-19, if that provides immunity, and secondly, how long that immunity would last for. Now, this will very much be a diagnostic tool. A lot of patients and a lot of people want to know whether or not they've had it. What they do with that information is up to you as clinicians to discuss whether that means they can move forward with treatment or not. But the British Fertility Society guidelines have suggested antigen testing. I haven't seen those as frequently as now the antibody tests. Now, obviously, antibody tests have had some very bad publicity at the start of the pandemic and are now getting very good publicity and are very much on our road to recovery. So if it's something you're interested in, I have shopped around. I've spoke to lots of different companies, and I am very pleased with what we found out about this particular one, which is called on-site rapid testing. It is for healthcare use only, but we have secured a special rate for Fertility Hub clinics. So you can find details of that on the Fertility Hub website, and that's under the news section. So basically, it's a very simple antibody test given by a healthcare professional. If you wanted to, not only can you test your staff, you can test your patients. Obviously, that's a pass-on cost to have the test. But if you wanted to, you can also test members of the public in your local community and be a local testing centre. So people are desperate to find out, but what you do with that knowledge is up to you. So it will give a diagnosis of people who have suspected to have had COVID-19. Very simple blood test, and you get the results within 10 to 15 minutes. So as I say, I'm very happy that we've managed to find a test that we think is worthwhile for clinics to look at, and that we found a very inexpensive and also an entry level, so that clinics didn't have to buy thousands and thousands of them. So please have a look on our website for that if antibody testing is something you'd like to introduce. Now, thank you so much for listening to me waffling on. I hope you found this information useful. As I said, there will be another seminar. I will be online now. I will continue. Any questions you've asked in the comments as we've gone along, I'll answer those now. And any more you want to ask, I'll stay online for at least the next 15 minutes to answer those questions. If you need to leave or you don't wish to comment, then please feel free to drop me an email. My email is veronica@thefertilityhub.com. Thank you very much.